So hey guys, welcome back to MedTen. So in this video we are going to discuss about the clinicals of the colon. We are not going to get into detail of the clinicals. We'll just look superficial to everything, just how much it is required for the UG students. So firstly we will be discussing about the examination of the interior of the colon. Examination of the interior of colon. So what is examination of the interior of the colon? Generally, to look at the interior of the colon, barium enema is used. We have the barium enema that is going through the anal canal, and that will give visualization of the interior of the colon. So barium enema is used for the visualizing the interior of the colon. So the typical pattern of the colon due to the presence of the circulations is clearly seen in this examination. Nowadays endoscopic examination of the interior of the colon is excessively done. So instead of the barium enema they will go for the endoscopy. So second thing is so we have something known as the Sprung disease. Sprung disease. So what is Sprung disease? It occurs when the neural crest cells will fail to migrate and form the Matriplexes. So we have the neural crest cells, right? During the fetal development, we have the neural crest cells and they will fail to migrate. They will fail to migrate to form the Matriplexes. So when the neural crest cells will fail to migrate to form the Matriplexes, so basically what are the function of the Matriplexes? It helps in the peristalsis, right? Peristalsis, that is the movement of the food, movement of the bowel. So basically it helps in the peristalsis. So in the basically these neural crest cells will fail to migrate and they will be situated in the sigmoid colon and the rectum during embryonic development. So this condition will result into the absence of the peristalsis. So as a result, the normal proximal colon will become grossly dilated. So the bowel will retain in the colon and it will become grossly dilated and it will cause the abdominal distension, and the constricted segment will usually correspond to the rectosigmoid junction. So basically these are situated in the rectum and the sigmoid colon and not along the entire the content of the GI tract. So this will lead to the absence of the peristalsis, leading to distension of the abdomen. So that is about the Sprung disease. Now let's look at the carcinoma of the colon. Carcinoma of colon. So what is carcinoma of colon? It's nothing but a cancer of the colon, cancer of the large intestine, and it is also the leading cause of death in the Western world. So it is relatively common in people who are above 50 years. It is relatively common and non-vegetarian. So it is a slow growing tumor and the causes of constriction of the colon, and the growth is restricted to the wall of the colon for a considerable amount of time before it spreads through the lymphatics. So in advanced cases what will happen? It spreads to the liver via portal circulation, and if it is diagnosed early, we can do the hemicolectomy. That is, we can do the partial resection of the colon to treat the patient. That is about the carcinoma of the colon. And also we have the surgical resection for cancer. We have the surgical resection for the cancer. So while planning resection of the colon, that is hemicolectomy, so generally it is affected by the carcinoma, the surgeon should remember some of the anatomical facts. So what are those facts? The lymph from the gut may miss the epiploic and the paracolic nodes. We have discussed about the lymphatic drainage in another video. Please make sure to watch that. So the lymph from the gut may miss the epiploic and the paracolic nodes, and they may directly go to the intermediate and the preterminal nodes. So they should check for the intermediate and the preterminal nodes. And the territory of the lymphatic drainage is divided fairly accurately into areas correspond to the area supplied by the main arteries. So they should generally look at the area supplied by the main arteries for the carcinoma. And also the removal of the lymph nodes is possible only after ligating the main arteries. So we should be careful about removing of the lymph nodes because they are closely attached to the arteries. So we have to ligate the arteries before removing the nodes. So thus the whole segment of the colon being supplied by the ligated artery should be removed to avoid gangrene. So these are the general points that the surgeon needs to remember for the surgical resection for the cancer of the colon, that is hemicolectomy. So finally we are discussing something known as the diverticulosis. So what is diverticulosis? So it is a common clinical condition of the colon which involves the sigmoid colon. So it is involving the sigmoid colon. So it consists of the herniation of the lining mucosa through the circular muscle. We have the circular muscle in the intestine called as the tinea coli, right? So this tinea coli will go for the herniation. herniation. So this herniation where it occurs, where the circular muscle coat is the weakest, that's where the herniation will occur, and it is pierced by the blood vessels. So that is known as the diverticulosis, which generally occurs in the sigmoid colon, and because of the herniation by the tinea coli, which are the circular muscle layer, and they will form the weak and they will go for herniation. So that's about the diverticulosis. So what about the fifth thing we are discussing? That is known as the volvulus. So what is volvulus? It is a clinical condition in which a portion of the gut will rotate either clockwise or anti-clockwise. So this is the normal gut. So either it may rotate clockwise or it may rotate anti-clockwise. So it is a clinical condition in which a portion of the gut will rotate clockwise or anti-clockwise on the axis of its mesentery. So usually it occurs due to adhesion of the anti-mesenteric border. We have the mesenteric and the anti-mesenteric border, right? So due to adhesion of the mesenteric border, it will generally occur. So it may correct itself spontaneously, or the rotation may continue until the blood supply of the gut is completely cut off, leading to ischemia. So the sigmoid colon is most susceptible to the volvulus. Which is most susceptible? That is the sigmoid colon. So that is about the volvulus. Finally, we have another thing that is known as the intuiception. Intuiception. So what is intuiception? It's a clinical condition in which the proximal segment of the bowel will invaginate into the lumen of the adjoining distal segment. So we have the another gut, this will invaginate into the distal segment. So the proximal segment will invaginate into the distal segment, that is known as the intuiception. So this may cut off the blood supply to the bowel, and also it may cause the gangrene. And we also have the various forms of intuiception, and they may be ileal between the ileum, and we also have the ileocecal where the ileum will enter to the cecum, and also we have the colocolic where the any other colon will enter into the any other colon. So that is about the intuiception. So basically this is just superficial about the clinicals of the colon, which a UG student must remember. So thank you guys, thank you for watching video till then. Please make sure to subscribe and hit the like button, and also share it to your other friends. Thank you.